Before the start of the video, if you didn't subscribe my channel, then click on the subscription button. In this video, you will come to know about the types of iron deficiency anemia. Following are the types of iron deficiency anemia. Vitamin B12 deficiency anemia. B12 vitamin insufficiency anemia, also known as cobalamin deficiency, is a disorder that happens when your body is not getting enough vitamin B12 to produce enough healthy red blood cells. To produce healthy red blood cells, white blood cells and platelets, your body needs vitamin B12. Folate is a deficiency anemia. When the body produces unusually large red blood cells that are unable to function correctly due to shortage of folate, folate deficiency anemia develops. Another type of anemia is iron deficiency anemia. Anemia is a disorder in which blood doesn't contain enough healthy red blood cells, and iron deficiency anemia is a prevalent type of anemia. The body tissues to receive oxygen through red blood cells. Iron deficiency anemia, as the name suggests, is brought on by a lack of iron. Another type of anemia is hemolytic anemia. Body tissues receive oxygen from red blood cells, and these red blood cells typically remain in the body for 120 days. Means that the average lifespan of red blood cells is 120 days. Red blood cells in the blood are damaged earlier than usual when someone has hemolytic anemia. Another type of anemia is idiopathic aplastic anemia. A syndrome of acquired bone marrow failure is idiopathic aplastic anemia. It develops as peripheral cytopenias, which are characterized by a decrease in all three major blood components: red blood cells, white blood cells, and platelets, to levels below the lower normal range. Patients may experience easy bruising or mucocutaneous bleeding due to thrombocytopenia, as well as fairness, pallor, dyspnea with excretion, and tachycardia due to anemia. Another type of anemia is Megaloblastic anemia. A type of Microcytic anemia called Megaloblastic anemia develops when the bone marrow creates stem cells that result in excessively big red blood cells, and these red blood cells are unable to perform their function in carrying and transporting oxygen to the body. Pernicious anemia. Red blood cells count declines due to pernicious anemia when vitamin B12 cannot effectively absorb by the intestine. Red blood cell count declines due to pernicious anemia when vitamin B12 cannot effectively absorb by the intestine. For erythroblasts to proliferate during differentiation, folate and vitamin B12 are essential. Folate or vitamin B12 deficiency prevents the DNA synthesis, leucoprotein and thiamethylate production, and induces erythroblast death, which results in anemia from inefficient erythropoiesis. Another type of anemia is sickle cell anemia, a hereditary condition in which red blood cells do not persist as long as normal red blood cells and have an irregular crescent form that blocks the small blood arteries. In other words, it's a condition of formation of abnormal shaped red blood cells that were unable to perform their function. Another type of anemia is thalassemia. Thalassemia is a genetically transmitted that is handed from parents to children. Blood illness that develops when the body doesn't produce enough hemoglobin, a crucial component of red blood cells. Microcytic anemia. Microcytic anemia is characterized by a low mean corpuscular volume, which is described as the presence of small, frequently hypochromic red blood cells on the peripheral blood smear. The most frequent cause of microcytic anemia is iron deficiency. Thanks for watching the video. If you didn't subscribe my channel, then click on the subscription button. If you want to know about pregnancy anemia, then click on the link given in the description below.